Hi everyone, thank you for being here for this new episode of Nepal Now, the podcast where we highlight different ideas and ways of moving the country forward. I'm Marty Logan, a journalist and communicator from Canada who's lived in Nepal for 11 years. Before we get into today's chat, a follow-up from our recent episode about the satire-writing ass of Nepali Times newspaper. By now you've probably heard about ChatGPT, the AI program that has become essay writing students' new best friend. Well, Nepali Times recently asked ChatGPT to write various types of articles as a demonstration, including an example of Backside, the former column by the ass. Unlike the straightforward news articles that the AI produced, the column is not impressive, illustrating at least one limitation of the software: humor. Check it out at the link in the notes to this episode. Also, a reminder that you're now able to support Nepal Now financially, if you wish. Go to our website, nepalnow.buzzsprout, buzzsprout.com, then to the black box titled Nepal Now Plus, where you can click to support the show. I've also included the link in the episode notes. If you have any questions or suggestions about this support, an idea for an episode, or anything at all, you can write to me at martylogancoms, COMMS, @gmail.com. Thank you. Today we're speaking with Bala Rai about the program One School, One Nurse. I thought it started in 2022, but it was actually 4 years earlier. Yet to date, it's reached just 1,100 of the tens of thousands of government schools. Still, providing health support and advice to school students on things like nutrition, menstrual hygiene, and mental health seems like a great use of limited resources. Bala, who is chief of the nursing section in the Nursing and Social Security Division of the Department of Health, says that expansion will depend on provincial and local governments also footing some of the bills. I also hope that the 3 levels of government find ways to adequately compensate the nurses, who are contract, not permanent employees, so they don't leave the country for overseas opportunities. Finally, thank you to Anita Shrestha, who wrote about the One School, One Nurse program for Himal magazine and suggested I contact Bala Rai for this episode. I've linked also to Anita's article, translated, in the notes. And now, please listen to my chat with Bala Rai. Bala Rai, welcome to Nepal Now podcast.
Oh, thank you. I'm so pleased to be here.
Great. I'm happy to see you. The program, or one of the programs that you're responsible for, I think it's called the One School, One Nurse program, was announced last year, so June 2022, I believe. When did it actually start? Like, when did these nurses start going to the schools and working in the schools?
Thank you. So this is the program that has been envisioned in the National Health Policy 2076 of Nepal. So there is a policy that states that now we need a health worker in one school. So on the basis of that health policy, this school health program has been introduced in Nepal. And as you have mentioned that you have read it about in 2022, but this program has started from 2018. So it has completed like 4 years right now. And first, this program was started from the federal government. And then later now, we have 7 provinces. So many of the provinces, like especially Bagmati province and Madhya Pradesh, as well as now Koshi Pradesh. So every province has started this program. Maybe some were started from 2019, from 2021. So gradually, all of the provinces have started this program as the federal government.
Okay, well, that's a surprise. I had no idea about that. I mean, I just read, there was an article in Nepali Times which got me, which is how I contacted you. Well, that's great to know that it's been going on. It's in every province. How many schools, how many nurses are involved so far?
Till date, collectively from all the province and the federal government, it's more than 1,100 nurses working in the government schools. From our division, we have reached up to 232 schools. And similarly, the highest number of school captured is by Bagmati province. There are 519 schools in the Bagmati province where this program is being started or being launched. And other province also has few of the numbers.
Okay. And I was lucky enough last week to meet a nurse in one school, in Hari Siddhi Secondary School in Lalitpur, and talked to her a little bit. And I was there to report about school meals. And she seemed to be spending a fair bit of her time with that school meal program. She was there when they were preparing and distributing the meals. And I know from reading this Nepali Times article that the nurse that was reported about in the article was also really looking closely at that program. Is that one of the main focuses, or is it just a coincidence that these two schools were looking closely at the school meal program?
So I think school day meal program is one of the activity or area where our school nurses are working, but their area of work or the job description is very broad. So basically the concept of school health program is based on the healthy lifestyle, promoting healthy lifestyle, because we are in the time where NCD is increasing, and we need to do something from the beginning, early years of life, so that our lifestyle is changed, and then we can prevent from NCDs. So, and then again there are other things as well from the NCDs, like menstrual hygiene. Since Nepal is the culture is very different, and still menstrual hygiene is like a taboo in our country. So menstrual health, and then sexual and reproductive health, and wash. So there are a lot of areas where school health nurses are working. And as you have mentioned, nutrition is also one of the components of their job description. So the day meal concept also again tie-ups with the healthy lifestyle. The students are not allowed to bring junk food at school, and they are promoted to bring healthy food from home. And those children who are being provided by the day meal from the government, our school health nurse prepares the menu every day, and then that menu is very much with the energy, the calories, the protein, the fat that the children needs. So it is based on that. They are trying to build a culture among the children that yes, we have to eat the food prepared within the school or within the home, and no junk food. And along with that, for the nutrition program, our school health nurses are also implementing different kind of national programs at schools. Nepal government is providing iron folic acid supplementation to the adolescent girls. So I think they are also involved in that program as well. And then the vitamin A programs, and we had COVID vaccination, now typhoid vaccination, and then recently filariasis also campaign was there. So whatever the programs that have been implemented by Nepal government, the priority programs that has been implemented in school level, all of those priority programs have been supported by our school nurses. So I think, yes, one of the area is day meal, definitely. But beyond that, also our school health nurses are doing so much activities at school level.
It sounds very busy, a really broad range. Let me just say that NCDs are non-communicable diseases, sometimes called chronic diseases also. So if people didn't know that acronym. You mentioned also sexual and reproductive health, I think. Also issues around menstruation. Are these kind of tricky for the nurses to talk about, to present? Do they face any kind of difficulties in speaking about these with the students or with anyone else around the school? Or how is that going?
As I mentioned, the sexual reproductive health and menstrual hygiene has been a taboo for us, for our culture. But I think the time has been changed, When we were in the adolescent period, the time was different. But right now, the adolescent girls and boys, I think they have a little more, they are open with anybody talking about these issues. But still, yeah, our nurses had some of the challenges in the initial days. So when our program was rolled out in 2019, and then in the initial days, there were some kind of challenges to talk with the students regarding, sex education or any of other sexual reproductive health issues or the menstrual hygiene as well. But later on time, when the trust was built, they were more interacted, and then they were sharing their issues and their problems. I think that they built a trust, and then they connected with the students. And in the later period of time, it was very easy, So there are a lot of evidence where our students had different kind of issues in SRH, sexual reproductive health and menstrual, and they openly talked with our school nurses, and they even referred them to the needer center. Like some students may require some family planning devices or some many other kind of services. So our school nurses also have started to link with them with the health facilities as well. So yes, definitely there will be a challenge, but after you build a trust, an environment where the confidentiality is maintained, they are opened up.
Okay, well, that's good to hear. I know in my country, Canada, these issues, especially around sexual, what we call sex education, or we used to call it when I was in school, that can also, often create some challenges because there are some parents who don't want it to be discussed, depending on the age of their children. That was like that when I was in school, and it's still happening today, that there are usually some opposition to a new curriculum. But it sounds like parents in Nepal, for the most part, don't respond that way.
Yeah, I think, the level of understanding has been changing according to the time. Yeah, some of the parents do maybe have some reservation regarding this kind of issues. But as far as when we go to the visit, we find that, yes, they are talking about this. And we do have the content in the curriculum as well. We do have the curriculum regarding the sexual reproductive health and the sex education materials. So I think there is we are starting to open up. It's not that, the parents are like, accepting everything. But yes, they are realizing that, yes, it is needed. And then I think they don't have that much kind of, a reservation for these issues. Slowly we are trying to reach with the parents as well. As our school health nurses also interact with the parents as well. So if she finds out any kind of the issues with the students, she will talk to her parents. Okay, we are having this kind of issue.
Okay, well, that sounds positive. So this issue, menstrual hygiene, and I know can often be a barrier in the way of girls actually going to school, right? So if the school doesn't have bathrooms, dedicated bathrooms for girls, there's no running water, the girl maybe doesn't have access to pads, that can actually prevent girls from going to school when they're having their periods. Is that changing now, do you think, because of the presence of nurses? Are nurses more likely to make sure that these things are available?
Yeah, I think few of the initiatives from government as well, like the water facility and the toilet facilities, different for the girls and the boys. I think it has been clearly mentioned by the government that when you are running a school, you should have a water facility. You should have the toilet different for the girls and different for the boys as well. And then again, Nepal government has been implementing the free sanitary pad program at school level as well. So I think that there are a lot of initiative that has been implemented by Nepal government, and now with the presence of school health nurse, I think that the policy that has been documented is been implemented very easily at the school level. Yeah, definitely when there is a presence of school health nurse, now she will be as an advocate to the management. Okay, now we need this kind of things in our school, like for disposing the sanitary pad, and the assurance of the water facility, the assurance of toilets. I think yes, she has been catalyst to implement the government policy at the school level. I would just like to share that, before school health nurses, there are a lot of high number of dropout rates among girls, due to these issues. So they are having periods, and due to the lack of the water, or sometime, due to the period pains, they were absent from the schools. So when nurses are there, and we have a sick room, so when they are having cramps, they can rest for a while, and there is a counseling done to her, and assurance of the safety during the periods, the sanitary pad availability. I think all of the things also has declined the dropout rate of the girls. So I think yes, definitely this has been changing. I won't say that you are having, the complete, we are getting 100% achievement, but yes, we are in the step of progress.
Okay. And I expect that because most of the nurses would be women, then the girls would find it easy to talk to them, right? So that would also smooth things over. I wanted to ask also specifically about mental health. I know that's an issue that many people are talking about these days, and there's all sorts of pressures. There are always pressures, but I think COVID-19 brought some additional pressures. Are the nurses able and willing to discuss mental health issues, or is that included in their area of work? Or
yeah, definitely. We always miss the mental health when we talk about our health. We more focus on the physical health. So what we do is, when we recruit our nurses, and when the first time they're posted in the schools, before that we give induction training to them, a 7 days induction where they are taught that how to, yes, definitely they have done a 3 years course before joining the job, but still they need some of the clarity in their roles, so that as a school health nurse, what are their the roles, how are they going to counsel, what are the areas. So definitely mental health is one of the component that has been added in their induction training. So as we know that the 50% of the mental health issues can be prevented when diagnosed at the adolescent level. So I think yes, they are capacitated in that way that they can identify some of the behavioral problems, like anger issues, and then the anxiety disorder, and then the attention deficit disorders as well, and the other issues has been recognized and they were referred. We do have examples like the autism. Autism also has been identified by our nurses when working in the in the primary level of the students. So they have referred the child to the health facility. The students coming in the government schools have the low economic status. Their mother and father are working somewhere else. And that has influenced their mental health as well, And our nurses have been working to identify. So they are not doing anything like treatment and other thing. They are just screening. Like if students are sitting alone at the class, or if he or she is not performing well or behaving something different, she notices. And then she refers to the health facilities. And we work as a team. The school health nurses have the connection to the health facilities around the school, So she has that contact so that she can immediately refer as needed, So yes, they are working to work on the mental health of the students. As we also have been planning for, it's like life skills. Life skills is also one of the components that has been included in the induction. So we are also working on that, Basically, I think one is healthy lifestyle for the physical health, and one is the life skills. How you manage yourself, how you understand yourself, and how you manage all of the behavioral issues. So I think that is important.
Okay, interesting. I wonder, do you have any specific goals or targets that you want to reach? So if we're talking about nutrition, for example, do you want to see fewer students missing school because they're hungry? Or I guess you could say the same thing about illness. Do you want to see fewer students missing a day because they say they have a sore stomach or a headache? Are there any targets like that, or is it just overall well-being?
I think we can tie up with our national target. So our national indicators are basically based on the SDG as well. So I think, yes, as a programmatic vision. We don't have that, okay, from the school health program we are doing that this much. That is not our, from the programmatic targets. But when we come at the national indicator, I think we can link with that. Like from the school health program, we are able to reduce the malnutrition and prevent obesity, as we are taking the BMI and we are working on the nutrition for the menstrual health also, and for the mental health also, and for non-communicable. So everything can be, yes, we can meet with the targets of the national indicators. One of the indicator we can tie up is that a screening of the students. So in the public schools, we have more than 1,000 students, and some of, in the list number we do have around 500. So there are a lot of number of students. So what government has stated is that, yes, now the students who are attending, the school should be screened once or biannually, so that they can identify the health problems of the students, like the eye vision problem or the hearing problem, anything.
Okay. This all sounds really, really good, really positive. Now, the nurses, how are they reacting? Because I would expect that some of them are going from situations where they have a very narrow kind of focus, a narrow mandate. They may be working in a hospital, but then you go to a school and suddenly you're working on nutrition and mental health and all these different things we talked about. Do they adjust well? I mean, do some of them have difficulties making the transition to this kind of role? And you're working with very young people instead of adults. How does that go?
Yeah. In initial days, we also felt that same thing, that, yeah, we may have that kind of challenges. But as, the nurses before working in the schools were trained in critical care. They are working in the ICU, and some are working in other clinical areas. So we also felt that how are they going to adjust in that environment? But later, what we felt that they were enjoying. They were enjoying what inside the school. They were enjoying in dealing with the students, and I think that most of the nurses are motivated, but yet what is their need is they want a permanent job. This is a contract basis job, and from their perspective they always mention that it could be better if we could be a permanent staff and working at the school. So those are some of the things I think we need to work maybe in the coming days to retain the nurses in their school. But the nurses that are now rightly working on, working as a school health nurse, I think they are happy and they are adjusted. We have the nurses working since 2018, so they are still with us. So they have blended so well, with the students, with the team, and with this program. And what we have done in, for the retention of nurses is that when we are selecting school health nurse, we have identified few of the criterias. And one of the criteria is that the local. If I'm working in Harisiddhi, I will get a little bit marks if I'm the local residents of that Harisiddhi, where the nurses can feel that, okay, this is my locality, this is my school, so I have to do something for this. I think that criteria has also helped them to blend in the environment. That has also helped us to implement this program smoothly.
Okay. So I think you said near the start that now it's close to 1,100 nurses who are on the job in schools. What's the final number that you need to reach, and how long before every school that needs a nurse has a nurse? Do you have any idea?
Actually, yes. I think in the long term, I think this is a program where education and health is coming together. Yes, because we are implementing health workforce at school level. So education and the health is coming together, and both of the ministry has planned to extend this program in all of the government schools. When you say more than 20,000, we have government schools at the secondary level. So when we coming to the basic level schools, we have more than that number. So yes, in coming days, government is planning to implement this program in all of the schools. When we are scaling up abruptly, I think that will be the high cost for the government as well, So slowly in the phase wise, I think in coming 5 years, we can go up to more 500. So basically, we will be scaling up in that way. As we have 3 tiers of government, what we also have planning is that now the federal government can look after the area where of the federal landmarks, and the province. Like I talk about the Bagmati province, as they have covered 519 schools, they can now scale up to other schools as well. So their cost is about 30 crores per year. 30 crores is a lot of money for us. So I think in that way, in Bagmati province or Madhya Pradesh or Koshi province, so all of the province can initiate this program. So it is the time now all of the government, 3 levels of government, adopts this program and implement in their all of the schools. Definitely, it has to be scaled up, as I've already mentioned that this is in the national health policy of Nepal.
Okay. And is there any particular reasons why a province or a local government would not do that now, besides money? Obviously, money is always the biggest question, but, are some of them saying we don't need it because we already have a good school meal program and so nutrition is fine and we don't need a nurse? Are they kind of pushing back against spending the money on a nurse, or everyone is willing to do it and they just need the money?
There are a lot of things. One is still we haven't been able to reach to them, highlighting the importance of school health program. I think that is also one of the setback for this program. And another, the political instability has also indirectly influenced this program. And the third one is the budget. More of the, the local governments and the school even contact us. Yes, we want this program. How can we bring this program? So now the federal government can't, always support them, because now we have the 3 levels of government, and the federalism principle is that they have their own budget, they have their own needs, they have their own programs. So what we feel is that it's better to initiate from the, local level or the province level. But still, they want to run this program. Most of them are very much interested. And sometimes there are the issues of human resources also, So you have one human resources working in the municipality, and that HR has to look after the various of things. So he or she doesn't want to have all the burden, There are a lot of factors beside budget to, scale up this program.
Okay. Anything else before we say goodbye?
Thank you for giving this opportunity, and we are looking forward to scale up this school health program, and definitely more focus on the promoting the healthy lifestyle of our children, our kids, so that we can have a healthy future in our life.
Thank you for coming. It was really good to hear about this, and best of luck on continuing to expand.
Thank you.
Thanks again to Bala Rai for speaking with me today. Let us know what you thought of this episode on our social media channels, Instagram, Twitter, LinkedIn, or Facebook. If you haven't already, why don't you take a moment now to like, follow, or subscribe to the show so you won't miss the next episode. Also, we've recorded our last 2 episodes at Radio Ujalo in Kathmandu. Thanks to everyone at the station for their support. Let us know if you can hear the difference. My name is Marty Logan. I'll talk to you again soon.